people who are narcissistic, though, they actually don't get worn out by that type of drama. They're almost immune to it. It's kind of just like the way they operate. So they're not as fatigued and worn out by it as the victim. And
Wow,
so,
that hits home. So
yeah,
true.
yeah.
Hey everyone, today I'm going to, have a discussion with an amazing guest, and we are going to talk in depth about trauma, narcissistic abuse. He's an expert. He's none other than Dr. Peter Salerno. So without any delay, let me invite him. Peter, thank you so much for joining in.
Thank you, Sarah, for having me.
Yes, and I mean, I keep going through your posts on social media and everywhere. And I mean, there is a great deal of things to learn, from what you're talking. I mean, how you are fusing neurobiology and emotions, together. I mean, it's a very interesting, perspective to look at. So, Peter, for my viewers, if you could,
Yeah.
introduce yourself.
Yes. So my name is Peter Salerno. I have a doctorate in psychology, and for the last probably 12 years, I worked in the psychotherapy mental health field. Now I'm
Mhm.
predominantly doing more educational work on awareness for the type of topics that you build awareness for as well. So types of pathological abuse, personality pathology, and typically what I try to do is increase awareness about some of the biological components or underpinnings to some of these disorders, because we're learning a lot more about how those things play a part. And so I think it's helpful for people to know that there are some things, not 100%, but there are some things that influence behavior because they're sort of that way from the beginning, as opposed to just focusing solely on environment. So I'm
Mhm.
just trying to just sort of bridge that gap of incorporating more of the biological and genetic, neurobiological information related to different forms of abuse.
Mm-hmm. Wonderful.
Mhm.
So, Peter, as clinicians, I think, we owe it to the survivors, to move past all those vague terminology, language, and really, define, what's happening to them neurologically as well as emotionally. And, that is something, what I want to know from you. I mean, there is still so much of confusion, around the term narcissistic abuse, narcissism. I mean, from your perspective, what truly defines it? I mean, what truly defines narcissistic abuse, especially beyond, the popular buzzwords?
Yeah, that's a great question. And I think you're right. There's a lot of information out there that's very helpful, but sometimes it's confusing.
Mm-hmm.
So it's important to understand that that form of abuse, oftentimes, even though it's not, you know, it doesn't feel good to accept or believe one of the things that makes it so severe is that a lot of the times it is intentional. And so when we
Mm-hmm.
talk about narcissistic abuse or something like that, often people will think, well, the narcissist was personally abused or neglected early on in life, and this is their way of dealing with it. But what research has shown us, even though it's hard to accept, is there are just as many narcissists who have not been abused, who grow up
Mm-hmm.
and create a lot of harm in the lives of other people. So we're starting to realize that these disorders and the abuse they cause are oftentimes related more to just how the person is, their inherent traits. And so now we're understanding narcissistic abuse as people who have elevated levels of traits like grandiosity or manipulation or antagonism or hostility, where they just have a higher level of this and this is how they operate in the world. And so if you're in a relationship with them, it's almost inevitable that you're going to be abused, because they may not see what they do or how they are as abusive, but it's experienced as that because it's so intense and severe and very inflexible in the way that they are, where they really don't consider how they affect other people. They're not, most of the time they're not very interested in that. They just feel like everybody should agree with them or just accept them as they are. And so you have this almost inevitable abuse in these relationships.
Mm-hmm. True. And also, Peter, I have seen, I mean, in my practice, I mean, maybe around 7 years, I have seen, survivors, especially, they often, get into this mode of minimizing their own pain,
Mm,
because there was no event, no solid event, that they can pin on. And it's almost like them getting into the mode of self gaslighting. And it's high time, I personally feel, and that's the reason I look out for people like you and other in this field, to bring more clarity onto these topics, so that a common person who doesn't have that word power still understands and at least identifies what he or she is experiencing or going through.
uh-huh.
Now, in many cases, Peter, there are no bruises. Let's
Right.
accept that. There
Yeah.
are no bruises, no visible scars, but the trauma runs deep. Could you please speak, to the kind of complex, often invisible trauma narcissistic abuse leaves behind? Because
Yeah.
often, people invalidate, they outrightly dismiss. Oh no, you had food, shelter, everything. What are you talking about? Mm-hmm.
Yeah. Well, first of all, research shows now that the type of abuse you just described that is invisible is
Mm-hmm.
just as impactful and damaging to the brain and nervous system and the physical body as more commonly understood abuse, like domestic abuse, domestic violence, and physical abuse. The emotional and even verbal abuse that
Mm-hmm.
individuals withstand that don't leave physical scars, but they leave emotional scars that are just as damaging to
Mm-hmm.
the body as physical. So we've known that now for years. That's not something that can be denied. People still tend to misunderstand that it must not be as bad because it's not physical, but that's just not the case. And what ends up happening to victims and survivors of this form of long-term chronic abuse is they actually they start to develop they can develop trauma symptoms just like if they were in a physical trauma, but they also develop confusion, complexities with their belief system. So things start to happen to them where they have contradicting beliefs, or they start losing touch with figuring out what's real and what's not because of all of the manipulation that's chronic. They're constantly questioning their reality, and like you said, the self-gaslighting. They are not sure that they're actually in an abusive situation because the abuser is so convincing that they're the problem. And when they end up in therapy with someone like you, for example, they often think they're coming to therapy because there's something wrong with them. They don't oftentimes wonder, maybe I need to go talk to someone because there's something going on with my partner. I mean, sometimes people do, but oftentimes clients usually come to therapy because they think there's something they're not understanding about themselves. And the truth is, a lot of clients end up in therapy because they are being manipulated and they don't even know how to make sense of it.
Mm-hmm. That's very true.
Yeah.
Now, Peter, I have been following you from quite some time, and one thing I deeply, appreciate about your work is how you bridge biology and behavior. That is something, which I really want to study more. I mean, the way how you view, the way how you analyze and, articulate things, especially, in reframing narcissism through a neurological lens. That is,
Mhm.
something that I want you to explain and educate my viewers. And it's such a shift from all that outdated moral or character driven narratives that we had been seeing all this while. Your work often highlights the neurobiological foundation of narcissism and even genetics. Could
Mhm.
you elaborate how all of this shifts or will shift our understanding of trauma survivor in therapy?
Yes, great questions. When I was studying psychology in my master's program and in my doctorate program, we obviously, and you as well, we learned the traditional theories of psychology.
Absolutely.
Yeah.
Hmm.
And it's important to learn those theories because they form, our understanding of the history of where we came from, why this is a field. And however, a lot of the traditional and popular theories were not testable when they were created because we didn't have the science we have today. And so now we have ways of testing, okay, this this is a theory about narcissism. It's related to development. It's related to child neglect. It's related to overvaluing people when they're young. Can we test it? Well, now we can. And a lot of the research in genetic studies, and specifically twin studies, because twins give us this interesting natural experiment where identical twins who were raised apart, how similar are they if they've never met, if they've never had the same upbringing, if one was traumatized and the other wasn't, if one was in one socioeconomic class in a family adopted and another one was in a different class. Now we have this very natural experiment we can make to see how similar they are just by being identical. And so
Mm-hmm.
now there's over 50 years of research that show that twins, identical twins who are raised apart from the beginning and have completely different lives, are more similar than two siblings growing up in the same family environment.
Mm-hmm.
So then we started extending that to, you know, psychology and psychopathology in general. How genetic are things? And genetic doesn't always mean inheritance. Genetic can also mean just the natural way things develop, right? It's just
Mm-hmm.
non-environmental, basically. And so we've done enough research now for over 50 years, even though it's not necessarily very well known or popular, that all psychopathology has a genetic link, has a heritable link, has a biological link. And so some people are more susceptible to becoming narcissistic than others. Um,
Wow.
and that's just a fact. It's not whether it's good or bad or right or wrong. It's not a moral judgment. It's nobody's fault. It's just really what the research is telling us is there's a high influence of this development related more to genetics and biology than just environmental experience.
Mm-hmm. Wow, that's fascinating.
Mhm.
One more thing I have noticed, Peter, that many survivors that I have worked with or I have come across, they get into this mode of internalizing the idea that they were the reason. They somehow invited the abuse because
Mm.
they had codependency. They were extremely codependent, needy. And I just love how you challenge that simplistic view. I mean, you just don't take it, you challenge that. And it really frames the conversation around agency and responsibility in a lot of ways. I love how you challenge the codependency narrative in general. And as a catch all for all the survivors, I want to know, Peter, how would you suggest we empower the clients who feel blamed for being a magnet, attracting narcissists? If you could tell us.
I think one of the most important things for them to know is we need to psychoeducate on the reality that there are just as many victims and survivors of this abuse who don't identify as codependent, who came from actually very loving, secure families. So they never anticipated meeting an abusive person. And so the education is important that these individuals will seek out anybody. They don't choose weak people. They don't choose codependent people. They will actually try to manipulate anybody. The people they actually end up manipulating on a long-term basis actually have a lot of emotional resiliency and they have a lot of strength, and they get manipulated enough that they can seem like they're dependent on the relationship, but that's actually a manipulation. It's not coming from within them. It's more situational. So I would say the majority of people that I've spoken to don't feel like they go through life feeling very needy or codependent. It's only in the context of the abuse that this they start to wonder about this. And I think also one of the reasons they wonder about it, some professionals do tell them maybe they have a codependency issue and that's why they got involved, or they're a magnet for abuse and that's why they got involved. I
Mm-hmm.
know the abusers will make sure that they believe that so that they stay, and then they think that they are the problem. But the research is showing that this is just not true. Any secure, strong person is liable to be manipulated by someone and abused. So
Mm-hmm. So we are not, born a magnet
No.
attracting toxic people and narcissistic people. Great.
No.
hmm Now, Peter, what you have described as the verbal sucker punch, I have seen that land, very violently on survivors. I mean, I personally feel it's not just words. I mean, it's a calibrated emotional ambush. I mean,
Yes.
I would definitely, let you explain that. I'm just not, trying to pin on anything. And, in some ways I also feel that naming it really empowers people. I mean, your concept of verbal sucker punch
Hmm.
reveals the strategic, almost ritualistic, psychological manipulation.
Yeah.
And that is something which you have described with that, I mean, with that verbal sucker punch. And I mean, how can survivors begin to interrupt those patterns in real time? I mean, it gets very difficult. I mean, there are lots of things out there. People get hold of a lot of information via social media. So how do we discern, and how do we interrupt, understand, and break those patterns?
That's a great question. Yeah, and I agree with you. It doesn't necessarily just have to be verbal. It's any strategy that's used to catch someone off guard, to ambush them.
Yep.
So I think, well, one of the things that's important to try to do is you have to become aware that it's happening, and so that requires, you know, sort of taking some inventory of the dynamics in your relationship. Like, how often do I think we're having a collaborative conversation, and then all of a sudden I feel like I got hit out of nowhere, or we're doing something together, and all of a sudden that everything changes, that the tone and everything shifts, just getting completely ambushed. You have to start identifying that, and like you said, naming it. And
Mm-hmm.
then in order to prevent it, this obviously other factors, like if physical safety is not an issue, what you need to start doing is almost and this is unfortunate that you'd have to do this, but these people know how to push your buttons, so you have to learn how to rehearse your responses to these things before they come up. So it's almost like
Wow.
you know how you're
Mm-hmm.
going to respond before they ambush you. So once they try it, you're equipped to, avoid getting caught into it, because these people really, they like drama. I mean,
Mm-hmm.
that's just the way they relate. That's the way if they can create drama, they're winning, the game. So rehearsing responses, I think, is very powerful. It can actually alter your behavior if you rehearse it ahead of time.
And how would you suggest one does that? Therapy?
You could do it in therapy. You could do it even role playing with somebody. You could even do a mental rehearsal of it. So
Mm-hmm.
before you're going to have an encounter with somebody that you pretty much know tries to catch you off guard or catch you off your game, or they typically like to throw a wrench in something collaborative, you can almost imagine that scene happening and then rehearse the response that you want to have
Mm-hmm.
before the exchange. It's almost like you're ahead of it. And enough practice and rehearsal, which is what we've learned, if you expose yourself to it enough times, it can also become more automatic. So then your rehearsing can actually happen instinctively over time. So you're never you can worry less and less about getting sucker punched.
Now, Peter, what struck me, in your work is the idea that, narcissists, I mean, for narcissists, chaos isn't disruption. It's a kind of a baseline. And that really echoes, what I, see in my clients and, people that I have worked with, who've just known, who've not, in any ways imagined, fathomed, or known that, uh, peace can exist without anxiety. Their version and idea of peace is chaos, drama, anxiety, stress. It's never peaceful, but everything else. Now, you've noted narcissists often see drama as a default baseline, not
Mhm.
an aberration. How do we help survivors reorient from chaos to emotional stability, according to you?
That's a very good question, but it's also kind of difficult to answer, because if you're caught in this chaos and drama
Mm,
long enough, your body and your nervous system actually, not necessarily crave it, but they're so it's so familiar that it feels like if it's missing, something's wrong. So oftentimes, people who have survived this form of abuse will think that once they have peace, they actually experience the peace or the calm as boredom. They feel like they're bored. Something's missing because they're so used to this jolt of energy or adrenaline to try to react to the
True.
drama. So
Hmm.
they can experience these depletions in energy or excitement or interest if that is missing. So people who are narcissistic, though, they actually don't get worn out by that type of drama. They're almost immune to it. It's kind of just like the way they operate. So they're not as fatigued and worn out by it as the victim. And
Wow,
so,
that hits home. So
yeah,
true.
yeah. So that's why they can do it for sustained periods of time, is they can live in this drama state, whereas the survivor is like trying to be reasonable and problem solve. But the side effect of being exposed to it for so long is actually that you almost start to expect it, and you need to not unlearn it, but you need to learn that that's not necessary. And there can be fulfillment and peace that is not mixed with anxiety and chaos, as you mentioned. I mean, there is a way to live connected and collaborative without any drama.
Hmm. So true. I personally feel, Peter, we as clinicians, therapists, coaches, we are trained, to hold space with warmth and non-judgment whenever we are dealing with our clients, survivors, you know. And also, we are, trained to treat those who are, battling narcissistic traits also. I mean, we are trained to treat everyone with compassion, warmth, and give them a safe space to, be themselves and not be very judgmental.
Yes.
I have found that unconditional positive regard can sometimes be weaponized. I mean, that's what I feel. I mean, maybe in the wrong hands. I mean, however you put it, but I personally feel it can be weaponized. Um, what are your thoughts on that? I mean, in therapy, we heavily emphasize unconditional positive regard, and yet you see, right in front of you that narcissists are, exploiting, validation. So,
Yes.
how do we assess, when kindness becomes, fuel for manipulation? I mean, for toxic individuals.
Yeah, this
What are
is
your thoughts?
such a great question. Narcissists, people who are tend to be pathologically narcissistic, they do weaponize things like validation in
Yep.
therapy. They experience validation as confirmation that they're right, not that they're
Hmm.
understood. So validation is about being understood. Confirmation is about right or wrong. And when you validate a narcissist, they internalize it as, now you're saying I'm right, I'm justified. And so it can be very weaponized. I don't believe that you have to give someone unconditional positive regard without without well, let me say this again. You can
Hmm.
give someone unconditional positive regard, but if they're going to exploit it, then you have to set limits to that and tell them harsh truths, and you have to correct people who are going to exploit it. And that's oftentimes why they don't stay long in treatment, because they don't like um, the harsh truths. They take it as character assassination. Um, but when you're working with somebody who's a victim or survivor of this form of abuse, I think you need to give them unconditional positive regard, but there also needs to be an element of psychoeducation. You need to say, look, this isn't something you can you can't validate somebody who's going to exploit you. You know what I mean? So I
Hmm.
think we even have to teach clients not to give people the benefit of the doubt, not to assume collaboration. It's not unconditional positive regard is something that is very helpful for two collaborative people in the room. It can be a danger if one person is not planning on collaborating with you.
Okay, so Peter, I find it really helpful how you bring in, the gene environment perspective, especially, when we are talking about narcissistic parents.
Hmm.
It really moves us beyond blame and into, understanding, how patterns are formed and passed down. I mean, you support gene environment, model, not blank slate theory. How
Yeah.
how does this inform our interventions, when healing trauma caused by, a narcissistic parent is, there in front of us.
Yeah, very good. Well, I think a lot of people, they're different people are going to respond differently to different parenting, right? And so we
Mm-hmm.
need to just educate on that. Like your response to it isn't necessarily good or bad or right or wrong, but your response is different than someone else who would have been in the same situation because of the genetic vulnerabilities, susceptibilities, and the gene environment interplay. So I think it's just an important topic and discussion to bring up in therapy that's not often considered. It's usually that
Mm-hmm.
there's assumptions made that this happened because of this particular environment and that's it, right? But I think that the discussion just needs to be brought up more. It's not,
Mm-hmm.
I personally feel that if there's a genetic vulnerability to a certain response to the environment in survivors or in the people who are abusive, I think it's compassionate to educate about that because it's a major component and oftentimes it's left out of the conversation. We're just making these predictions or correlations that if you had this experience, this is why this is happening. Um, so I just think that the genetic discussion needs to be better understood and it needs to be more incorporated. And we don't even have to say genetic. We can call it, tendencies or inclination or propensity. It doesn't have to be, because the term genetic scares a lot of people. Um,
Absolutely. Mm-hmm.
I think people assume genetic means hardwired or predictable outcome. That's not really what we're saying. We're just saying that some people are more vulnerable to certain ways of being, and some people are going to interpret their environmental experiences differently based on some inclinations that may have already been there, right?
Now, this one is going to be an interesting question that I'm going to throw at you, Peter, and I would want you to answer as honest as you can.
Sure.
There is still, this pervasive myth that all narcissistic individuals, all narcissists are secretly insecure in some ways. But, clinically, the picture is so much more complex. I mean, not just insecurity. I would love you to unpack, the distinction between, fragile ego and grandiose entitlement. I mean, if you could simplify it for my audience.
That's a wonderful question. It's controversial when I answer this. Um, some people think, oh, that makes perfect sense. Other people think, oh, you shouldn't say that. Um,
Mm-hmm.
I'm somebody who believes that no matter how long something has been believed, it should always remain open for examination. It should always be testable. Okay. And so there is a lot of research now that says there's a very weak correlation to self esteem and narcissism or insecurity and narcissism. I'm not saying we should throw all the other research or speculation out, but what I'm saying is now there is other research that says there are narcissists who exist who are very secure, have a very high self-esteem. They may have a fragile self-esteem when they're confronted, but they don't actually internally feel insecure or bad about themselves, and they don't feel shame walking around all the time. And
Wow.
and there is research that shows they're not protecting themselves from this profound shame. Some of them actually very much believe they're entitled to special treatment and they feel good about it. So when this question comes up, I don't want to take the approach of everything that we've ever learned is wrong and now this is the new idea. I'm just saying we need to bring this into the equation, and there is empirical data that shows this.
Mm-hmm.
They've done studies that narcissistic traits are present and expressed in childhood, that they increase in adolescence, and that
Mm-hmm.
a lot of kids who bully each other have very high self-esteem. They're not the
Mm-hmm.
bully isn't always the child who has a bad childhood and a bad home life and hates themselves inside. Some of them feel really good about themselves, and that actually makes them feel more entitled to offend other people. So it's it should be a conversation about both. And I think that that's just hard for a lot of people to accept, because we've had this idea that if someone mistreats you, it's an inferiority complex, it's insecurity. They learned it from the way they were treated. Sometimes people come from warm, loving environments, and they still are very mean to other people, and they hurt them. And
Mhm.
so,
Again.
True.
So, Peter, you have written about how, a narcissist, views people. I mean, they view people as just tools and objects, and not partners and, people in relationship. And,
mhm.
that's something, survivors often don't see until they are deep into, the pit. Yeah. And I'm curious what micro signs, we can look out for early on in such relationships. Or, I mean, for example, I'm raised by a narcissistic parent. I mean, what are the signs? Where do I start? Or if I got married to a guy, I mean, where do I start? What are the signs to look out for? What are the green flags and the red flags in simple version, simple word, if you could tell us?
Yeah, that's very difficult. If you're raised by somebody who is narcissistic, that's especially difficult, because who's gonna, one, a lot of people still assume parents don't hurt their children on purpose. So even if you said something about the way you felt like you were being treated unfairly as a child, or it just didn't feel good, children also typically, who are not narcissistic, they blame themselves for the way their parents treat them. So that one's a difficult one, and that's honestly really not my area of expertise with parenting from narcissistic parents. Um, as far as getting into relationships and noticing the red flags right away, I think everybody wants to put their best foot forward, make a good impression when they meet someone.
True.
That's not pathological. That's just human nature. But
Mhm.
some things to look for are the intensity that's right away with these individuals. They tend to want to seal the deal very quickly.
Wow. Please repeat that again. Please.
These people tend to want to seal the deal very quickly,
Mm.
right? So they're not operating off of intimacy, they're operating off of intensity. And
Wow.
if you're vulnerable in a negative or positive way in that moment, I'm not saying vulnerable human, I mean, if that's a moment where you can be, you know, coerced or manipulated, that's going to be dangerous. I think some people, because some people, when they meet someone that's interesting, and narcissists can be very interesting, fascinating people in the beginning. They present themselves in that way, so it's very appealing. You almost want more of that, and so if they try to seal the deal quickly, you're gonna maybe be willing to go along with that. And I think you should listen to your instinct that there's really no such thing as a shortcut in getting to know someone. I mean, you have to put in the time. So anytime someone's trying to rush or push something quickly, have you make a decision that's important very quickly, I would say that's kind of a red flag, because they should respect your ability to make decisions informed, rest on things, sleep on things, take your time. And I feel like people have reported to me consistently over the years that when they've gotten involved with somebody like this, there's just this rapid intensity that, like, the relationship progresses very quickly, and then they're stuck, almost, because they've already committed in a pretty significant way very early on.
Peter, I have seen, I mean, working with a lot of survivors and, my clients, and, they have this, over and over, this, self-blame thing. And,
Mhm.
they tell me, during the session that, Sarah, if I would have done a little better, I'm sure things would have been better. I would have been able to, change him. I would have transformed him. But I mean, luck had different plans. God had different plans. I ended up in divorce. I got separated. Could you please tell us what is this self-blame that we get to see in survivors? It resurfaces very often. I mean, I have seen it a very common thing.
Yeah.
And I mean, how can we educate them and tell them to not hold themselves responsible for all this, BS that they are getting into for
Yeah.
whatever XYZ reason?
Yeah,
How can we do that?
it really
Mhm.
is BS. I think it's coerced from the beginning of the relationship that, with these individuals, the person will the pathological person will blame the victim, or
Mm-hmm.
not even overtly, but they'll find ways to almost make it seem like the misunderstandings are coming from the victim, or the lack of collaboration is coming from the victim, or the emotional dysregulation is always the victim. So I think it's partly that these individuals can be pretty skilled at convincing you of something that's not true. And people who are good people, often they really want to problem solve, and when they can't, they sometimes wonder, well, maybe there's something deficient in me if I can't seem to get this to work. um, it's very rare that somebody would naturally instinctively think, I wonder if I'm being manipulated right now. I mean, we just typically don't think that instinctively.
Mm-hmm.
So the self blame is an easy way to try to make sense of something that's just not understandable, and that's not, reasonable. Um, and a narcissistic person will be very willing to let you think that about yourself. So that's one of the components of that. I think as
Mm-hmm.
far as educating, if we educate people properly that there is an intentionality to this abuse, that there's nothing you could have done or could not have done, there's nothing you could have said or not said that would have changed how they are. If people can really get that education and information and believe it, I think it helps a lot, because people get the idea that the relationship problems are made in the relationship, co-created, they're mutual, and oftentimes it's just really not true. There is one person who is not playing fair, and it's just rare that we think that way. I think the only people I know who think that way are the ones who've been through this and survived it, and they realized, wow, I was being manipulated a lot. And so I think this education, there's a reality that we have to accept, that some people are predatory in relationships, and they're going to blame you for things, but um, you, it might not be your fault at all, really.
Mm-hmm. And also, I would like to know, your views, about this idea. I mean, does a narcissist ever change? A lot of people reach out to me and they tell me, Sarah, can I bring my narcissistic husband? Can I bring my narcissistic parent? And I just, I mean, hold my hands together and I say, no, I don't want that. I mean, it's okay. I mean, you are welcome, but it's okay because they are not aware, they are not ready to explore, and they are not reaching out to me. You cannot drag a narcissist, to a place like my place. So I would want to know, do you think that narcissists change over a period of time? I mean, do they become better? Is there any scope of betterment, or they just become more toxic with time? What are your thoughts?
So the research shows that if they're not treated appropriately, meaning clinically treated effectively, then it's not really just going to go away on its own. These disorders don't change on their own. So the longer they go around across life, the longer they practice expressing these pathological traits, the more they settle into them, and it's almost like they manifest even more across life if there's no intervention. I don't typically therapy with somebody who is truly personality disordered, as far as couple therapy or family therapy, they're actually not indicated, because again, the dynamic can be weaponized, the therapist can be used against the victim, there's all kinds of
Mm-hmm.
things that can go wrong there. So that's not really indicated, and people need to realize couples therapy won't change narcissism. um, a relationship won't change narcissism. Doesn't matter how loving, empathic, understanding of a person you are, you can't love the narcissism out of somebody. To answer your other question about do they change, there
Mm-hmm.
are some experts who claim that they can do very effective work with some narcissists if the narcissist comes to treatment individually and the narcissist does the work. So we also can see this as a spectrum of mild to moderate to severe. And there are some professionals who work with narcissists and work with other personality disorders and say that yes, They actually, some of them, typically from mild to moderate presentations, can in fact not, maybe they don't become that different, but they can learn how to behave and treat people better.
Another thing that I have noticed, Peter, is that, whenever we, talk about narcissism, narcissistic abuse, there is a, section of society that comes at you, that, really, comes at you saying, do you have a certificate? I mean, can you prove that he or she is a narcissist? Do they have a
Oh,
certificate from the expert? I mean, have they been proven as a narcissist? And I personally feel narcissists don't roam around with certificates. Hey, I'm a narcissist. I'm at this, level. I'm at this degree. No, they don't do that.
no.
I mean, how do we, handle such situations? I have seen a lot of survivors also, reaching out to me and telling me, I don't think my mother is a narcissist. Sarah, you might be wrong. I don't think my father is a narcissist or my husband is a narcissist. So, I mean, how do we handle such situations? I mean, this is, a question, as a therapist. I mean, I want to know, you are an expert, you are, in this field from quite some time. I'm pretty new. So I would want to know, how do we handle such situations? Because, narcissists don't run around with certificate, and, there is no census that shows, the correct
Yes.
data. Yeah, because they keep mutating. I mean, I have seen some of them, pretending to be, extremely victim needy, and all of a sudden, when they are triggered, that grandiose, thing just comes out. And, they are real shapeshifters. So, I mean, how do we handle this situation when people, come, forward, in order to protect them and whitewash their deeds? What do we do about that? What do you think, Peter?
Yeah, these are great questions. So I have worked with quite a few people who were absolutely, they had no idea that they were raised by somebody who was narcissistic or disordered, and trying to convince them of that is not the way to go about it.
Hmm.
But here's what I don't think you need to even use that term to get somebody to understand. I think what it is if you ask the right questions, they will tell you what they're dealing with, and then they will understand what they're dealing with. So when we talk about narcissism, we talk about enduring patterns of behavior, pervasive enduring patterns across the lifespan. No matter how you try to collaborate, problem solve with them, no matter how you try to take accountability for your part, the problems don't change, they don't get better. New problems are created, conflicts are always escalated. We can ask the right questions to somebody, and they will start to see this is a chronic, persistent problem across the relationship that is affecting my quality of life. That's different than somebody who you're in a relationship with who has depression, or somebody who has PTSD. There's certain um, patterns that arise when you're in a relationship with someone who's narcissistic, and so you don't have to try to convince somebody of it. If you know the right questions to ask them, they will give you the feedback that will pretty much um, describe what they're dealing with. So I think trying to make somebody believe that they're dealing with it when they're maybe in denial about it or they're unsure, the solution to that is ask the questions that are going to get um, like the undeniable evidence that we're dealing with these enduring pervasive patterns. And we use clinical terminology for those enduring pervasive patterns, um, for our own purpose, for purposes clinicians use them for their own purposes. But you can informally also get an answer and a description of somebody based on a history, right? Um, and so that's actually also the method that's used when somebody comes to your office and has a personality disorder, is you ask the right questions and they reveal that their history shows that these are pervasive enduring patterns. It's not just once in a while or when something bad happens. This is just the way they are. So I think it really just comes down to knowing what to ask,
Hmm.
and then they will come to terms with it eventually, when you can kind of, it almost unfolds naturally at that point.
Hmm. Um, Peter, that's a very interesting thing that you have said. Rather than, throwing labels or, pathologizing things, the best thing is to ask questions and let them process and let them, answer, from their heart. I have seen, a lot of survivors and victims, they are, literally disabled, they are unable to answer, simple questions also. And I personally feel, there is this role of cognitive dissonance there. I mean,
Yeah.
we can see, and, they have a lot of confusion. They just don't have clarity. And, they really don't want to, accept that they are going through that. I have seen,
Yes.
and heard, survivors telling me and expressing that my mother abused me because she had a difficult backstory. My daddy was like that because of a difficult backstory. My husband was abusive because he had some work pressure. I have seen them saying this. They are, expressing that they are uncomfortable in the relationship. I would want
Yeah.
to know, I mean, what are your thoughts? I mean, are they also, battling cognitive dissonance? Are they also experiencing, cognitive dissonance? Plus, I would want you to, tell my viewers,
Hmm.
about this term called trauma cognitive dissonance.
Yeah.
I would want you to educate them on that as well. Peter.
Yeah. Thank you. This is great questions. All your questions are wonderful. They're really good.
Thank you.
These are all the questions I get asked all the time, so it's very fitting. I So cognitive dissonance is really something that we all experience as human beings, in the sense that if we come across some information that is new to us that might threaten what we previously believed, it will create contradiction of thoughts. And so then we resolve that in a number of ways. People can resolve it through denial, which is what you kind of just described, or justification.
Mm-hmm.
Um, Traumatic cognitive dissonance is different because cognitive dissonance can happen very naturally, whereas traumatic cognitive dissonance, my definition of it is that it's happening because someone is intentionally manipulating your reality. So
Wow.
there's a difference between just having two contradictory thoughts and trying to sort it out, and somebody implanting those contradictory thoughts so that you don't have the ability to know what's real. That's what I would call traumatic cognitive dissonance, and it's typically from someone who is disordered in a way where they want you to be confused, right? Um, as far as the question of the justification of, well, my mother treated me this way because she had a hard life. In my book, the nature and nurture of narcissism, I share my mother's story with her mother, and
Mm-hmm.
my mother, even though now she knows that her mother was not very kind to her, she will still say things just instinctively if the conversation ever comes up. Well, my mother had a very hard life,
Mm.
and it's like that doesn't that doesn't have anything to do with the way she treated you. I know that's hard for a lot of people to accept, but a lot of people have really hard lives and they treat people with kindness and love, and they don't hurt them. So the idea that if you have a hard life, you give people a hard time is just really not true. That's an association that's not accurate. There's other things going on. But yes, to answer your original question, good people typically put the blame on themselves, and they typically come up with an excuse or an explanation for why someone is mistreating them. And so I think our role as experts and educators is to say, sometimes people are mistreating you on purpose, and it's not because they were mistreated. They're benefiting from it in some way. People have certain kinds of wiring, sadly, that they find it beneficial to take advantage of people. And so we have to really accept this. We have to accept the nature and nurture of life, not just this nurture uh, argument.
Mm-hmm. So, Peter, do you think that, gaslighting is another love language for these narcissists?
Yeah, I think some people. I do. I think some people. Well, it's not just my opinion. Research has shown some people have a lens where they go through life thinking that in order to get what they need, they have to exploit, they have to coerce, they have to manipulate, They have to persuade. They can't play fair, or they're going to get taken advantage of. They really believe this, and that is technically that's their love language. You know,
Mm-hmm.
it's the way that they express. Now, I mean, we're using the term love language. Is it's not really love, but yes, that's how they get their needs met. Is
Mm-hmm.
by they think if I don't exploit people, I'm going to be exploited, or I'm going to miss out on something. This is how I get my needs met, is I have to take advantage. And I believe they
Mm-hmm.
sincerely believe that. That's distorted. I think that's a disordered way of thinking, but they do truly believe it.
Mm-hmm. And also, Peter, I would like to know, I mean, this is for my viewers, how common is, narcissistic personality disorder? How common is, narcissistic traits? Because, again, there is, a huge lot of people out there, they'll come, and, throw labels at you. They'll tell you, stop pathologizing, things, and, stop
Yeah.
throwing labels. Don't do this, don't do that. Even though, a person is meeting all the criterias, mentioned in the DSM, and, I mean, everywhere. And we get to see such fraction. So I would want to know, I mean, these narcissistic individuals, narcissistic traits, narcissistic personality disorder, has there been any research conducted apart from the one that we get hold of on the Google, 1% or 2% of the population is
Hmm.
narcissistic and all that? I mean, how common do you think this problem is?
Yeah, that's a great question. I think we have to factor in whenever we're doing a prevalence estimate that it's a sample, right? So it's not we're not able to get 8 billion people to get assessed,
Mm-hmm.
but the samples can be very indicative of accuracy. You can draw conclusions from them. In clinical populations, we see a certain percentage, and then in general population we do. And what we've learned now is NPD is not the only personality disorder that involves pathological narcissism. So now we have multiple personality disorders. Um, Not the same thing as split personality or dissociative. I mean, just different disorders adding up to increase the prevalence of narcissism. And recent prevalence estimates from all the disorders that include narcissism is like 15 to 19% of the population. So
Wow.
it's not a small percentage. There's a vast majority of individuals who have um, a good level of narcissistic pathology. Whether we want to say that that's um, just their natural way of being, or that that's a disorder, that's another story. But if we're just talking about the prevalence of the narcissistic traits and the effect they have, it's pretty significant in the population.
Peter, what are your thoughts on cluster B as a clinician? If you could tell us your thoughts.
Well, cluster B personalities are typically known as the dramatic, erratic, and more severe ones. They used to be referred to as the immature disorders at one time.
Mm-hmm.
I think that those are the ones that most people describe when they're describing the problematic sort of drama in relationships. And the reason for that is because I'm not trying to judge anybody, but the people who have cluster B pathology are typically the ones who have a lot of difficulty collaborating in relationships. They have a lot of difficulty taking accountability personally for their part in conflicts. And so I think that it's a legitimate way to understand that there's a large percentage of people who have severe impairments in empathy, severe impairments in interpersonal functioning, basically. And most of the time, when people are talking about the personality disorders that are the problem in a relationship dynamic, it typically there's some cluster B features. Obviously, it could be cluster A or cluster C, but
Mm-hmm.
it seems like cluster Bs are the ones who garner the most attention because of that drama component. So,
Mm-hmm.
but
True.
the ones who come to treatment and want help, I think that's courageous and admirable of them, and I think you treat them like you said with respect and dignity, and if they're willing to do the work, that's great. But they
Mm-hmm.
oftentimes they oftentimes don't come because they don't think they're the problem. So
Mm-hmm. True. Uh, Peter, before we, end today's session, I have got two more questions. You can, answer them, in a precise, brief manner if you wish and please. Peter, I want to know what is the probability, of a victim or someone who's been raised by a narcissist growing up to be a narcissist or an invert narcissist? What are the chances? Because I personally, I mean, I have observed that, even though they are calling out the narcissist in the family, in the relationship, but in a way they start exhibiting the traits as well. They are not aware of it, what they are doing, but in
right.
a way that is not something which is healthy that they are engaging in. So what are your thoughts about that?
I think we can be influenced by narcissism in the sense where there's a learned tendency to be a certain way, in a sort of reactive way. That though is not the same thing as a personality disorder. So that's something that is malleable and it can be changed or modified, right? Sort of like a type or a style. You can
Mm-hmm.
modify it. Um, my question, what comes to my mind when you say that though, is there are genetic links to this. So
Mm-hmm.
um, it's possible that it wasn't because the person was raised by the narcissist. It could also entirely be possible that they just share the same DNA, and so it's sort of like it's both. It's not that the way they were raised made them that way. It's that they were exposed to it, but also they had the traits. They were going to have the traits regardless. So that's kind of an interesting study, I think. Um,
Mm-hmm.
because people don't think to ask. I wonder if people are similar because they're related. They just now in most of the time people think if you are acting this way, it's because it was modeled for you. But the modeling could be that you are coming from the same place genetically,
True.
right? And that's
True.
not just with narcissism. That's with anxiety. I mean, we've now shown that
Mm-hmm.
there's a biological version of anxiety that's not created from the environment. Some people just have more anxious or neurotic traits naturally. Um, Not good or bad, but that's just the facts. So I think um, that's just an interesting question. We have to control for environmental influence and we have to control for genetics all the time.
Mm-hmm.
We have to do both. We
Mm-hmm.
can't do one or the other.
Absolutely. And before I conclude today's session, Peter, my last question to you is that, your research invites professionals, a lot of professionals, people who are in this field to rethink, entrenched theories.
Yeah.
What one key, shift you would like therapists or coaches out there to make, when assessing and, treating trauma from narcissistic abuse?
Wonderful. I think I think it would be a good idea to factor in and investigate the research that is more related to behavioral genetics and
Mm-hmm.
neurobiology, and not neglect that. I think it's been dismissed for a very long time, or it hasn't seemed relevant. But if people can, um, you never just want to do the research that supports your preferred theory. You want to look at the research that supports that contains all the evidence. And so it's not a matter of right or wrong. I think that there's a lot of really interesting information out there that's talking about our evolutionary history as human beings, in our DNA and our biology, and how relevant that is to behavior and psychology. So I would say just investigate all of that. You know,
Any tools that you would like to suggest
well,
that these therapists can take help of?
I mean, now
Modality. Mm-hmm.
there's new research, there's new trainings that incorporate this now. So if you're getting continuing education, there's more opportunities to get this perspective now. And so just kind of maybe look for that specifically if you need to get your continuing education and your continuing training or your specialties. Look for training programs that incorporate this type of data, and you'll be very surprised. It's pretty fascinating. It's not intended to discount what you've learned. It's intended to build upon it. And I think it makes your career and your understanding very interesting. You know.
Wow. Thank you so much, Peter, for joining in today. It was wonderful, and I'm looking forward to have you again with
I would love to.
another list of questions because I want to learn. I am going to be a student for the rest of my life, and I'm sure there are other students out there who are curious to learn from different minds. I mean, wonderful minds like you. Thank you so much, Peter,
Thank
for
you.
joining in today.
Thank you for having me, Sarah.